Good morning, children. Hope everybody is fine and safe at home. Today, before we begin with our half-yearly syllabus, I would like to give some information regarding the present situation, COVID-19. Let us understand what is corona. It is also a part of our subject, invisible, pathogenic and pandemic coronavirus. Someone has correctly said, health is everything. Without it, you have nothing. Take care of your health. Health has no alternative. The COVID-19 outbreak has disrupted the academic year. UNESCO report says nearly 300 million students worldwide are out of school due to COVID-19 pandemic. What does COVID-19 stand for? CO, corona. VI for virus. D, disease. Coronavirus disease. Formerly, this disease was named 2019 novel coronavirus. COVID-19 is an infectious disease caused by a newly discovered coronavirus. What is coronavirus? A newly identified virus. Coronavirus are named for their appearance. Under the microscope, the virus look like they are covered with pointed structures that surround them like a corona or crown. It emerged in China in December 2019. Investigations are ongoing as how this virus originated and spread. How does the coronavirus spread? This virus spread through droplets released into the air when an infected person coughs or sneezes. The droplets do not travel more than a few feet and they fall on the surface in a few seconds. This is why physical distancing is effective in preventing spread. Now, what are the symptoms? Fever, cough, shortness of breath, persistent pain or chest pressure, bluish lips or face, body ache, sore throat, loss of taste or smell, headache, fatigue, nausea or vomiting. What is the incubation period for COVID-19? Incubation period means the time between catching the virus and beginning to have symptoms of the disease. Incubation period for COVID-19 range from 1 to 14 days. How long does the virus survive on surface? May persist on the surface for few hours or up to several days. This depends on type of surface, temperature or humidity of the environment. If you think a surface may be infected, clean it with disinfectant and protect yourselves and others. Clean your hands with a hand rub or wash with soap and water. Avoid touching eyes, nose and mouth. How is COVID-19 diagnosed? There are two tests, one molecular test and a serological test. In molecular test, taking a sample from the back of the throat with a cotton swab, the sample will undergo PCR test, polymerase chain reaction test. This test can only help diagnose the current cases of COVID-19. Serological test, another type of test. With the help of a blood sample, this test detects antibodies that the body produces to fight the virus. These antibodies are present in anyone who has recovered from COVID-19. Now, what are the preventive measures? Tips to prevent coronavirus transmission. Prevention is always better than cure. Awareness of the preventive measures are very important to practice it effectively. Everyone has a role to play in taking care of ourselves and our loved ones. I repeat, everyone has a role to play in taking care of ourselves and our loved ones. Wearing a face mask can help to prevent from transmitting the virus to others. Use alcohol-based disinfectant to clean hard surface. Take physical or social distancing seriously. If you want to go out for necessities, keep a distance of 6 feet from other people. Do not gather in groups. Avoid eating or drinking from public places. Virus can be transmitted through food, utensils, dishes, and cups. Wash fresh groceries under running water before eating or preparing. Regular washing of the hand with soap and water, or cleaning hands using an alcohol-based sanitizer. Taking plenty of healthy, nutritious, and well-cooked food to improve our immunity. Taking these preventive strategies seriously is exactly important to stop the transmission of the virus. Knowledge and awareness of the risk factors of corona will be an added advantage, aiding in effective prevention. Now, while watching this video, you may be thinking, what is the use of this topic? Yes, it is important to spread knowledge of a particular problem that we are facing today. It is very important. The first step towards change is awareness. Studies reveals that a school-going child comes into contact with 3 times as many people as the average adult does, putting children at a high risk of contracting the virus and transmitting it. Many children do not display symptoms, only heightens the risk of the disease spreading undetected. The study found closing schools could slow the epidemic by 40% to 60%. The experience of going through a crisis can create the desire for reform. A great hope in the control of infectious disease is always a vaccine. A vaccine will be the best effective to battle the coronavirus. At the global level, more than 140 candidate vaccines are under various stages of development. With the discovery of coronavirus vaccine, definitely we will go back to normal social life. When something is gone, something better is coming. Till then, stay home, stay safe, take care of yourself. Thank you.